serving as Executive Director of Clinical Education for Obesity Medicine Association. He's a graduate of the Philadelphia College of Osteopathic Medicine and completed his family medicine residency at Metropolitan Hospital, Parkview Division. Dr. Pennings is a champion for advancing the education of healthcare professionals through the development of core competencies in obesity medicine education and incorporation of obesity education into medical education via live and virtual platforms. And we are so grateful that you are joining us today. Welcome, Dr. Pennings.
Well, thank you for having me, Susan.
Absolutely. We know how busy you are, so we're so happy that you're here with us. Dr. Pennings, there is so much to talk about for people who are living with diabetes during healthcare appointments. And those visits go by so quickly, the time is so precious. What is the best way to bring up the essential topic of obesity management with your doctor or your healthcare provider during a medical visit?
Well, that's a great question, and I think it's very important to talk about obesity and talk about your weight, and because it has such a big impact on your diabetes. But we know that type 2 diabetes is primarily driven by insulin resistance, and excess weight is a primary driver of insulin resistance. And so anything you can do to manage your weight will help with the managing your diabetes. And so it's important to bring it up because your doctor may not be sure you're comfortable with talking about your weight, as a lot of patients can be hesitant to bring up weight as they may feel they're going to be judged or criticized or spoken to harshly about their weight. So sometimes there's a tendency not to bring it up, and I think it's so important to discuss. I think
It really,
in the course of oh, go ahead. Did you have a
no, I was going to say that's a fantastic response, and it really is important in such a sensitive topic.
It is, and it's hard to talk about sometimes because there's been likely a history of frustration of losing weight and gaining it back, losing weight and gaining it back, and feeling kind of hopeless and helpless. And that's even more challenging in when you have type 2 diabetes, especially if you're on medications that promote weight gain, like insulin and sulfonylureas, like glipizide or glyburide or glimepiride. Those agents can promote weight gain, and so if you're taking those medications and you're gaining weight and you're struggling with your weight, that may be part of the reason why.
That's just a great way to kick off today's conversations. And as those of you who are attending today's event, everybody on the line now, you can see that Dr. Pennings is an expert in this field. So please, if you have any questions, as a reminder, for those who are joining by phone, please press *3. That's *3 on your keypad so we can take your questions. You'll be able to ask them live in queue. And if you're participating online, please type your name and your question in the fields below the streaming player. And remember to hit the submit question button so that you can ask it live. And Dr. Pennings, we already have a number of questions coming in. We actually have a question for a person, Pam, who's living with type 1 diabetes in Arizona. And Pam, please go ahead and ask your questions to Dr. Pennings.
Well, I've been told that I am obese by my doctor, and I was given no advice except to exercise and watch what I eat, which I've been doing all along. Now, I am postmenopause, and I've also been on prednisone for another condition other than diabetes. Um, I haven't had been on prednisone for a while now, though, but the weight just doesn't want to come off. And I'm wondering if there's anything else I should do, like hormone therapy or anything like that.
And so that is a challenging situation. I mentioned that, insulin and sulfonylureas can cause weight gain, but certainly prednisone can cause weight gain as well. And that's very frustrating, especially in combination with menopause, where you tend to gain weight, particularly around the central part of your body, and it doesn't go away very easily. Diet and exercise are things that's important to that when you restrict your calories or you increase your activity or do both, and you do what we call a negative energy balance, meaning you're burning more calories than you're taking in. Well, your body's natural response is to increase your appetite. And so you're going to be more hungry when you eat less and exercise more. And so that is the whole role of working with somebody who can prescribe medications that can help you to lose weight, the anti obesity medications that can help you to get to a lower weight and combat that hunger. Now, you can also combat that hunger by focusing on the type of foods that you eat. If you're eating higher protein foods, if you're eating more the foods that have a large volume without a lot of calories, in particular vegetables, tend to fill you up with fewer calories. Protein tends to fill you up with fewer calories. And that can counter some of the hunger that happens when you calorie restrict. So I would, that's one of the challenges that I find a lot of patients face is that they're told to lose weight, but they're not told how. And that's largely because physicians haven't been taught how to help people lose weight. And working with somebody that's experienced with that could be a big help to help you get to a healthier weight.
And Anne, thank you for that question. That's a common question that we often hear as healthcare providers. And Dr. Penning's response was excellent. And in addition to that, I would again give a plug to asking your physician or your healthcare provider for a referral to a registered dietitian nutritionist and for medical nutrition therapy so you could have a one-on-one individualized plan. There may be certain things in what you're eating that they can suggest that works with you and your food preferences, even within your budget, your cultural background, that you might not have thought about that could help you on this journey as well. So exploring those different options is very important. So thank you so much for that question. Dr. Pennings, we have
Absolutely. You want
another.
to optimize those lifestyle changes.
Always, always. And I think that it's very important to explore the entire healthcare team, which I'm sure we're going to talk about a little bit more today too, but medical nutrition therapy in addition to all those other options can be very helpful, and it's just such an untapped piece of the puzzle. It really is.
Yes.
Dr. Pennings, we have a question coming in online from Michael that I'd like to ask. It's a really great question. Is there any way to reinvigorate my GLP-1 product? He had great success at the beginning. So I would ask you, Dr. Pennings, to explain what GLP-1 is and maybe a little bit about weight loss medications and then address Michael's question.
So, as I mentioned, weight loss medications are intended to help manage that hunger that naturally occurs when you're in a calorie restricted state. And there's a number of different options, but the ones that have given the most attention recently, and mainly because their potency is really quite a bit higher than anything we've ever used, is medications that are in the GLP-1 or glucagon-like protein peptide, glucagon-like peptide category. And these agents mimic what our body naturally does. GLP-1 is naturally produced in the intestines and sends a signal to the brain to create a sense of fullness. They also slow how fast the stomach empties, so you tend to feel full longer with a meal as well. And so these medications were originally developed and indicated for diabetes, the first one being exenatide or Byetta, which was approved in 2005 for the treatment of diabetes. But now we have the semaglutide and tirzepatide that work on this GLP-1 pathway. Tirzepatide also works on another pathway that also not only help you control your blood sugar, help lower your blood sugar, improve your insulin response, but also help decrease your appetite. And that decreases your caloric intake, which is going to improve your blood sugars as well as improve your appetite to help you decrease your consumption. And so, what ends up happening, though, sometimes is that the effect of decrease in appetite can lessen over time. It doesn't happen to everyone, but it does happen to some people, which can be a little bit frustrating. So, there's some around that. One is making sure you're still being vigilant with your dietary efforts. The medications don't fix your diet for you. They help it make it easier. If you're not hungry, it's easier to avoid some of those tempting foods that we all eat. But we don't eat just because we're hungry. We eat for various behavioral reasons. We eat because we're happy, we're sad, we're bored, we're seeking reward. Everybody else is eating, we're celebrating a happy event. And those behavioral components become very important. And sometimes they start to override your appetite suppression. So if you're really craving certain foods or you're exposed to foods that are very tempting, that can still pose challenges even if you're on a medication. So, one, I would see, have you maximized the dose of the medication that you're taking? But also, more importantly, are you still following those healthy dietary principles? Are you following a healthy diet? Are you continuing to engage in physical activity? That's still a very important. In fact, it's one of the most important components of weight maintenance is regular physical activity. And then, are there certain behavioral triggers that are causing you to get off course?
On the subject of exercise, and I'm seeing a few questions come in on this, and people are asking, is walking enough when you're managing your weight with a weight loss medication like a GLP-1? Do you need to do strength training, balance training? What is some of the suggestions with exercise when you're losing weight and you're losing weight at a pretty fast clip? What kind of exercise is usually recommended?
So that's a great question because exercise is not just one thing. I think the first thing to recognize is that any type of physical activity is beneficial. So people will ask me, what is the best exercise? I always say it's the one you'll do every day.
Yeah.
So right? So looking for something that you enjoy doing, something that you can do consistently is important. And the greatest benefit from exercise goes from doing nothing to something. But to really get the full benefits of weight maintenance, you need to do at least 150 minutes of moderate exercise and preferably up to 300 minutes a week. That's an hour, 5 days a week. That can be very hard to do. But the key is to do something. And walking is a great exercise if that's what you enjoy, but it's not a very intense exercise, but it is a good exercise to do. You do need to do different types of exercise. So we can do cardiovascular exercise, which would be walking or jogging or an exercise bike or biking, any kind of continuous activity that gets our heart rate up. That's cardiovascular type exercise. But you also need to do strength training, especially if you're losing weight, because when you're losing weight, you lose both fat and muscle, and we want to preserve muscle mass, and strength training is very important. So, at least 2 days a week to do some form of strength training, working different muscle groups to help maintain muscle mass. Um, Other activities, there's two other components to exercise that people don't often think about, and that is flexibility, that we want to maintain our flexibility of our muscles to decrease risk of injury, and balance, that neuroproprioceptive, meaning that we help to be able to balance ourselves to decrease our risk for falls and also keep ourselves from injuring ourselves. So those are two other components of exercise that are not often thought about.
Such a great point. We so rarely talk about flexibility and balance, and it's extremely important as we're not going to say old, as we're getting older every single day, they even become more important. So to incorporate that into your daily movements is extremely important. We have another live call coming in from Sandy, who is calling from California. Sandy, please go ahead with your question. Sandy, are you there?
I'm here. Sorry.
Great.
Hi.
Hi.
um, my question is I am type 2 diabetes, and I've been on the GLP medicine for 1 year now. I'm on Ozempic and then the Q point, but I'm not losing any weight, and I do exercise about 3 to 4 days a week. I I had knee surgery not too long ago, so that kind of maybe probably set me back a little bit. But anyway, my diet you pretty good, but sometimes I it's not. So I try to really stay on a really good diet plan, and I'm just not losing anything. And I don't know if I should change medications or if you have any suggestions for me.
Okay, so it sounds like you've had some challenges, and that I'm glad to hear that you're very concerned about and making that effort to try to get to a healthier weight. It when you the GLP-1 agonist, as I said, like the medication that you're on, you said semaglutide 2.0 milligrams.
Yeah.
Okay, and that's the max dose of that for the treatment of diabetes, and that should be quite effective to help with appetite. But you still do need to combine it with a healthy diet and perhaps working with a dietitian or a certified diabetes educator on reviewing your diet and making sure that you're doing the things that you need to do to engage in a healthy diet. When you are sedentary, by consequence of having to had surgery, it's very difficult to continue to lose weight when your activity is limited. And so I think it's important to work with your therapist to increase your mobility, increase your physical activity, and gradually improve your mobility. And that can help with your weight loss. And it's not just about weight. It's not always about just some number on the scale. And I think we
Mhm.
have to really look at are we eating healthy? Are we making healthy food choices? Are we managing our portions effectively? I think that's such an important part. Are we engaging in regular physical activity? Those are key components. And then another thing that's, again, often overlooked is sleep. You want to make
Yes.
sure that you're getting adequate sleep. 7 to 9 hours is considered the optimal range for sleep. And if you're sleeping less than that, is particularly if you're sleeping less than 5 or 6 hours a night, your hunger hormones are higher, your fullness hormones are lower, your cortisol levels are higher. All those things drive up both your sugar and your weight and your appetite.
Thank you, Sandy, for that question. And I was just thinking along the same lines that we don't bring up the topic of sleep and stress reduction often enough. And it's often overlooked. And that's a very important part of health. It's just such an important part of health that we don't discuss. Dr. Pennings, I have this discussion with people who are living with diabetes and obesity management questions all the time with physicians and other healthcare providers. When the healthcare provider may just brush it off, physician may just brush it off and say, come back in 6 months and lose 10 pounds, come back in 6 months and lose 20 pounds. And what the person with diabetes does, the person who wants to become healthier does, is just not go to their follow up appointment because they feel like a failure or they feel like they're disappointing their healthcare provider. And they definitely feel like they're letting themselves down. What does someone do in that instance?
You have to think about that. Say you went into your healthcare provider and your blood pressure was high, and your provider said, "I want you to lower your blood pressure by 10 points," and then just left. Or said, you come in and your blood sugar is high, and your healthcare provider said, "I just want you to lower your blood sugar by, 50 points." and then didn't do anything. That, would that be the patient's fault or would that be the provider's fault? And to me, I look at it the same way with weight. For a healthcare provider to tell you to lose weight but not give you any means of doing so, is not a fault of the patient. It's a fault of the system not providing, or it's not for a fault of the healthcare provider not providing you with the information, the tools, or a referral to somebody that can help you lower your weight. But just telling you to do it, our body's weights are regulated by our appetites, and our appetites are regulated by internal signaling in our body. We make hunger signals, we make fullness signals, and that's what regulates our weight. It's what regulates our appetite. When you have obesity, you tend to have things like leptin resistance, which means when you are calorie restricting, you're more hungry than somebody that has a normal weight. And so you need to be able to counter that and treat that effectively. And you can't just wish it away, and you just can't say, well, I'm going to lose weight. Well, what does that mean? You really need to have a logical plan and a strategy to lose weight.
I completely agree. And I would say that if you're very frustrated in a conversation about that with your healthcare provider, it may be time to seek a different healthcare provider if that is going to be a stumbling block of you taking care of yourself. You are your own best advocate. So be perceptive in that conversation as well. Advocate for yourself.
Or
We have
ask them to refer you to somebody, to refer you to,
absolutely
a registered dietitian for counseling, for nutritional advice, or refer to an exercise physiologist for physical activity, or
great
behavioral
point.
therapist if you're dealing with some of the behavioral challenges, or an obesity medicine specialist for medical treatment of obesity.
Absolutely, absolutely. Uh, Betsy comes in with a question online, and Betsy, thank you for this question. Betsy asks, how do I overcome a weight loss plateau?
Well, that's a common question and a big challenge that we face. Our bodies, as I mentioned, are designed to prevent starvation, not obesity. So when we're losing weight, it's not uncommon for our bodies to hit a plateau. And I often describe weight loss as more like going downstairs than a slide. We tend to lose weight, plateau, lose weight, plateau, lose weight, plateau. So plateaus are really just part of our body's natural compensatory response to weight loss to try to resist it. Throughout time, starvation has been the biggest challenge for human beings, and so our bodies have all these internal mechanisms to try to resist weight loss, and that has served us well until we moved into the 20th and 21st century, where we have this obesogenic environment that promotes weight gain. And so plateaus often require some patience. It's an opportunity to reflect and see, are you really optimizing your efforts? Are you optimizing your efforts with your nutritional efforts? Are you optimizing your physical activity? Are there certain behavioral issues that you have? Are you struggling with cravings, or maybe eating a little bit larger portion than you were before? Is your sleep where it needs to be? So those are all things that to look at and review. But sometimes it requires just patience. Sometimes people are going through difficult times. They have a lot of stress going on in their lives, and they still expect to lose weight, even though they're dealing with home stress or work stress or both stressors, or other factors that are coming into their lives. So sometimes you also just have to kind of ride out the storm, wait till you get to the other side, and resume your efforts to get back on track again.
And Dr. Pennings, you bring up a really excellent point too. If you're going through a lot of stress, also ask for a referral to a mental health professional who may be able to explore different options, different coping options with you that might help alleviate some of that stress, build some tools in your toolbox to deal with the stress.
Right. I mean, that's important for both weight management and for glycemic control, for managing your diabetes. Stress will raise your blood sugars. They will make it more difficult to control your diabetes. And people don't often realize that they sometimes just perceive that their blood sugar control is solely dependent upon their food. And it's not. It's definitely affected by your sleep, by your stress, by your physical activity or sedentary or lack of physical activity. All those things are going to impact your blood sugar. If you're sick, if you have an infection, it's not food that's driving your blood sugar up. It is, those other factors.
Mhm. Absolutely. And as a reminder, if you're joining us by phone and you'd like to ask a question live, please press *3. That's *3 on your keypad, and your question will come in live to us. We have a question from Linda, who asked if I would read her question aloud, which is a good question. Linda says, what medicines make you gain weight when taking diabetes medicines as far as pills? So we can even kind of be flexible with that questions. Are there any medications that a person with diabetes may be taking that may cause weight gain? And I think that you addressed a little bit of that earlier, but maybe you can expand on that for Linda.
Absolutely, that's a big topic, and an important one, and one that is not often considered by both patients and by healthcare providers. They often don't think about the impact of medications, and there's a long list of medications that promote weight gain. We talked a little bit about insulin, sulfonylureas, the glipizide, glyburide, clomipramide, pioglitazone is another medication for diabetes that causes weight gain. We talked about steroids a bit, that is another agent that can cause weight gain. Uh, Beta blockers can cause weight gain, particularly metoprolol and atenolol. And one thing that's important to remember is that when not everybody gains weight on these medications, some people do, some people don't. But if you're a person who's gaining weight and you're on these medications, it's definitely something to consider. So, some other medications, gabapentin and pregabalin, are commonly prescribed for chronic pain. Those can promote weight. A lot of the medications for mental health issues, for depression,
Yes.
paroxetine in particular, which is Paxil, can cause weight gain. There's several others that can cause weight gain, particularly if you're on them for a longer period of time. So the category called the SSRIs, the sertraline or Zoloft or Prozac or fluoxetine, are agents that can cause weight gain if you're on them for a prolonged time. And there are several other medications that are used to treat mental health conditions that can cause weight gain. A common one that's over the counter that's maybe not thought of very often is diphenhydramine, which is Benadryl. That's the
Mhm.
PM in a lot of the medications that, like a Tylenol PM or Advil PM. The PM component is diphenhydramine, and that component can promote weight gain. So those are some of the medications that are commonly prescribed that are associated with weight gain.
It's so interesting because there are so many medications that are both prescribed or over the counter that can cause weight gain.
Right. So we have to be wary of those. And as I said, they don't cause weight gain in everybody, but if you're gaining weight and you're taking that, you may want to see if there's an alternative. The diphenhydramine is not a good medication for sleep anyway. It does make you sleepy, but sleep is a restorative process for the brain. The brain has to go through different stages and cycles throughout the night in order to feel rested in the morning. And while the diphenhydramine or Benadryl can make you sleepy and sleep a lot of hours, it doesn't necessarily create a restorative sleep that makes you
Mhm.
feel refreshed in the morning.
Excellent advice. Thank you for that. We have a live question coming in from Jonah. Jonah is calling us from California. Jonah, please go ahead with your question.
Uh, well, I'm in territory, Berkeley, California, and my question is, I have two permanent disabilities, cerebral palsy with low vision, but I also have diabetes too, and have been in depression sometimes. Now, how does the obesity? I'm not that obese, but let's say 150 to 155 pounds of linebacker style, roly poly, sort of like my grandpa used to be. So how does the obesity play into all these things? I mean, I'm not that mobile a quarterback. We're in an electric wheelchair, but sometimes I too have sleep difficulties. So how do we play with this when my urinary tract is off?
Um, so, we talk about obesity, we base it on BMI and we base it on weight, but really it's much more nuanced than that. Because one of the questions I'll ask my medical students is, what BMI causes you to have diabetes? And there is no one BMI that causes you to have diabetes because it's more complicated than just a BMI number. It's really, you know,
What's
how much
BMI,
body
just to
fat you
clarify?
have. Oh, I'm sorry, body mass index. So so it's not just a weight that causes you to have. So the BMI is a way of we describe weight in medicine, and so it's not just your weight that causes diabetes. It's a combination of just how much body fat you have and where that body fat is, and how much muscle mass that you have, and how active your muscles are. So those are kind of the key driving factors of the diabetes and the health consequences that go with that. So, what you're looking for is to really um, try to make sure that you're keeping the muscles that you can move as physically active as you can. And with the CP, you certainly have challenges around that and limitations around that. But making sure that you're working the muscles that you can work, that you're maintaining some regular physical activity, that can be really important for your diabetes because we, as I mentioned in the beginning of this, that diabetes, type 2 diabetes, is a condition of insulin resistance, meaning that your body doesn't respond to insulin like it should. And one of the ways of improving that insulin resistance is through physical activity. And there are exercises that you can do no matter what your condition is to be able to, you can move your arms using bands, doing there's this ergonomic machines where you can kind of pedal with your hands, or just doing kind of dance exercises with your upper body. But looking for ways that you can increase your physical activity becomes really important, especially if your activity is already limited. And then looking at, the dietary components that you're taking that might be contributing to your weight and your blood sugar. One of the things that I really like, if you have access to it, and not everybody does, and I understand that, but if you have access to a continuous glucose monitor. So these are monitors that you can put on and they monitor your blood sugar continuously. And what's really great about that is not so much the blood sugar number, but the information it gives you in relation to your diet. So you can see when you eat certain foods, how high does your blood sugar go and how long does it stay high? And the purpose of that is really to give you feedback and help you make better choices so that you're picking foods that don't raise your blood sugar so high or keep it so high for so long. Another way of doing that that I recommend to my patients with diabetes is to just, if they don't have access to a continuous glucose monitor, is to use the regular glucometer and check their blood sugars 2 hours after a meal. A healthy blood sugar 2 hours after a meal should be less than 140. And if you're taking your blood sugar 2 hours after a meal and it's high, well, that tells you that your body didn't handle that meal very well. That meal caused your blood sugar to go high and stay high. So if you're eating a high carbohydrate meal or something that has a lot of sugar in it, and that is like pancakes with syrup or something, and you're seeing your blood sugar is really high 2 hours later, well, that tells you that that's how your body responds to that food, and that you need to make a different choice if you want to control your blood sugars. So that
Thank
is
you.
another
Yeah.
cool way of helping to manage that.
Thank you, Jonah, for that excellent question because Dr. Pennings brought up the aspect of a CGM or a continuous glucose monitor, which is extremely helpful and important. And like he said, it's not a judgment. It's giving you data, information to work with that you can share and discuss with your healthcare provider. It's so helpful. And there are also the continuous glucose monitors are covered by many insurances for people with type 2 diabetes, right, Dr. Pennings? So that might be something that you can ask for or discuss with your healthcare provider.
Absolutely.
Yeah, I think that that's super important. We have a couple of good questions coming in online as well, and there people are asking a bunch of the same things. So I'm going to ask Tiffany's question, and Tiffany asks, "Is it recommended for people over 70 years old to take a GLP-1 or something similar for weight loss?"
And so I, there isn't an age restriction on that. I think it's important when you're, as you get older, you're at higher risk for losing muscle mass. And so nutrition becomes really important if you're going to follow that path. Interestingly, also, unless your BMI is your body mass index or your weight is really high, um, benefits to your weight being a bit higher as you're older. That there's something called the obesity paradox. That as you get older, that your a higher weight tends to be more protective. Um, but if you're have a lot of health consequences, you have diabetes, you have cardiovascular disease, you have a lot of what we call metabolic conditions or health conditions that are related to like sugar or blood pressure or cholesterol, then taking a GLP-1 can be beneficial for both weight loss as well as for cardiovascular protection and reducing your risk of a heart attack. But again, it's really important that if you're going to lose weight, that you do it with proper nutrition, that you're getting adequate protein in your diet, that you are engaging in physical activity, that includes strength training, so that you don't lose muscle mass and weaken further, because that is not going to benefit your health.
And that's where what you brought up before, it's not simply about your scale weight. And maybe that's particularly important for a person who is older and may be at risk for osteopenia or osteoporosis or bone loss and lean body mass issues. So it's very important to discuss that with your healthcare provider. And it brings up other questions that I'm seeing here as well, which is how, if you've been seeing a healthcare provider and you are very sensitive about the discussion around weight management and obesity care and obesity management, how do you bring up the subject of weight loss medications with a provider if they haven't brought it up to you? How do you begin that discussion?
Well, I think, as a patient, perhaps bringing it the same way that I try to bring it up as a healthcare provider when I talk to my patients, and that is doing it in the context of your health, and perhaps saying that, I'm worried about how my weight is impacting my diabetes or impacting my blood pressure, or impacting my heart, and would like to know, are there any things is there anything that I can do to help to lose weight? Are there medications that I'm on that might be making my weight more difficult to come off? Are there alternative medications that I can take that might help me to lose weight? I think taking it from that health approach and saying that you're concerned about how your weight is impacting your health is a good way to begin a discussion.
And beginning a discussion that way also will show your doctor or your healthcare provider that that's a topic of discussion that's important to you. So again,
Right.
advocating for yourself is very
Right,
important.
your healthcare provider may be reluctant to bring it up too because they may be afraid that you don't want to talk about it, and that's actually a common misconception of healthcare providers that their patients don't want to talk about their weight. And the other common misconception is that patients feel that it's their responsibility to take care of their weight, and that the healthcare provider shouldn't have any role in that, and that's not true either.
Very good points. Absolutely. Rich is dialing in with a question, but he'd prefer, Rich is from Buffalo. He'd prefer that I ask the question, and it's a very comprehensive question. Rich wrote that these are a lot of good suggestions, like glucose monitoring and possibly changing healthcare providers. But this may be easier said than done. What if a person does not want to spend days monitoring, and it can be very difficult to find a new healthcare provider? So, what kind of encouragement can we give to Rich, who asked that question?
And I don't know that changing your healthcare provider is always necessary. Making sure that, perhaps you tap into other resources in your community if you have them. So asking your healthcare provider to refer you to a dietitian or refer you to maybe a behavioral therapist if you're struggling with maybe insomnia or stress factors or, dealing with some of the mental health drivers that may be making it much more difficult for you to lose weight. Um, so I think that is part of the process. Um, and so look at what your resources are. Do you belong to a gym? Do they have a personal trainer? That many gyms will provide a certain amount of personal training at no cost. If you're a senior, you can participate in senior silver sneakers. So there's often resources that you want to make sure that you're taking advantage of, and identifying which ones you have access to. Um, with respect to monitoring, monitoring for with a CGM or a glucometer doesn't have to be a forever thing. That, or at least not measuring all the time. All the time. As you test your blood sugar in relationship to different foods that you're eating, it doesn't take too long to identify those foods that make your sugar go up and those foods that don't. And so I don't think it's a ball and chain you have to be stuck with for a long period of time. I do think if you're doing it for a couple of weeks, you quickly learn what are the drivers of your blood sugar. And those drivers of your blood sugar are also likely the things that are driving your weight up.
And Rich, thank you for that question. A lot of times people don't want to be reminded all day long by CGM and blood glucose monitoring that they have diabetes, but Dr. Penning's advice that you can use it and see how your physical activity, your stress, your sleep, your food intake is all affecting your blood sugars. It may be very helpful in moving forward and making some changes. So, thank you for that reminder and for sending us your question. We have another live question that's coming in from Joan, and Joan is from Texas. Joan, please go ahead with your question.
Yes, I can eat breakfast and not eat all day long, and my sugars will still be high.
So the question is that you can not eat all day long, and you find your sugars are still high. And I had mentioned earlier that it's not just food that causes your blood sugar to go up. That, like, for example, if you go to bed at night and you check your blood sugar and maybe it's 90, and then you don't eat all night, and in the morning it's 120. And many patients will ask me, why is it higher in the morning than it was at night when I didn't eat anything? And that is because in the morning your body is releasing adrenaline, it's releasing cortisol, it's releasing these hormones that drive up your blood sugar. It has nothing to do with food. And so stress can do the same thing. It can trigger your liver to release sugar and raise your blood sugar because we store a whole bunch of sugar in our liver. And when we're stressed, when we're not sleeping, we can trigger our liver to release this sugar and make your blood sugar go up. And not eating can be a stress response that your body is feeling in a starvation state. And so sometimes that eating and eating the right things can help manage your blood sugar better. But you also have to make sure that your diabetes therapy is the right therapy. Are you on adequate therapy to control your blood sugar? So if it's running high even when you're not eating, then you also have to look at what your treatment regimen is, and maybe you need some modification there as well.
Joan, thank you so much for that question and for your call. And that's maybe a time also to speak with your healthcare team and your healthcare provider about any changes that may be happening in your life. Maybe something changed since your last visit and you don't have another visit for a few months, but that's okay. You can contact your doctor's office or your nurse practitioner's office, your provider's office, and let them know there have been some changes in your life, and therefore there may need to be some changes in your treatment plan, or you may need referral to another healthcare professional as an adjunct therapy. Would you agree, Dr. Pennings, that that also might be an issue?
Those are excellent points. I agree completely.
Yeah, because things change over time. So it's really important in today's conversation about it's how to have a conversation about obesity with your healthcare provider to schedule an appointment if this is a concern with your healthcare provider to focus on obesity management and additionally to set realistic weight loss goals. Learn about treatment options that are available. And Dr. Pennings really did an amazing job with talking about and giving us so many tips and so much education on that there are various treatment options available, starting with lifestyle changes, with nutrition, exercise, stress management, making sure that you have enough sleep. And although we may not have focused too much on it today, making sure that you're also well hydrated. Ask for appropriate referrals to a nutritionist, registered dietitian, nutritionist, physical therapy, mental health specialist, whatever is needed to help you with your treatment plan. And all of your questions were so phenomenal today. If we didn't get to your question, please send it to us. And we're sorry that we weren't able to address it live, but there were some really great ones coming in. Dr. Pennings, are there any key points that you would like our listeners to take home from today's discussions?
Well, you brought up one thing that we didn't really discuss, in talking about how to have a discussion with your healthcare provider, is to have a dedicated visit to have that discussion because obesity is such a complex problem and because there's so many components to its treatment, addressing nutrition, addressing physical activity, addressing behavioral therapy, looking at medications that may be causing weight gain, considering medications that may help you to lose weight, anti-obesity medications, that it really deserves a dedicated visit, that it's tough to squeeze that into a visit with your diabetes, high blood pressure, cholesterol issues, and any other items that you may have. So I think that's a great kind of parting point. Think about asking your physician to have an appointment specifically dedicated to addressing your weight and what strategies you could employ to help get to a healthier weight.
That's a really important point, and I'm glad that you brought that up as part of this discussion to really highlight as a takeaway. One of the ways that we can be advocates for ourselves is to help set the agenda for appointments. So if there is so much going on, which there is with diabetes management and diabetes care, obesity management and obesity care does need to be a separate appointment. So all of these points can be addressed. And when you do need to set an appointment about that, whether it's through setting it up, making sure that that's done in advance through a patient portal or contacting the office to make sure that that's what's going to be discussed. I think that that's very helpful for providers as well to know why you're making this appointment and why you're going in, and that you're very serious about the discussion.
Absolutely. I think that's something we often overlook, both as healthcare providers and as patients.
Absolutely, absolutely. So, Dr. Pennings, that was amazing, and thank you so much for your time and all this information. Remember to talk to your doctors and members of your healthcare team about the obesity focus visit and all those options that are available to you. And again, please go to diabetes.org/obesity for more information. Register for the next event at diabetes.org/experts and sign up for diabetes education programs near you. Please call 1-800 342-2383 or email askada@diabetes.org to request a copy of today's of How to Thrive resource that could help you on your diabetes journey. And we thank you so much for all the great questions that you called in and you wrote in with. And call 1-800, again, 342-2383 if you want to share any more of your thoughts or have any questions. Thriving with diabetes takes a team, as we discussed today, and we are here to support you. A very special thanks to Dr. Pennings, who is absolutely excellent as our guest expert today. My name is Susan Weiner, and on behalf of the ADA team, we look forward to you joining us for our next Ask the Expert events that are coming up. Our next one is soon on October 8th at 2 p.m. Eastern Time, the latest in type 2 diabetes and technology. And on October 24th at 8 p.m., obesity care treatments, not one size fits all approach. You can register for all of these events at diabetes.org/experts. Please visit our website for more information at diabetes.org/experts and register today. And if you have any questions at all about this event, please email askada@diabetes.org, and please include Ask the Experts Q&A in your subject line. Thank you so much for joining, and please stay tuned for our very brief survey coming up right now, because your feedback is extremely important for us planning all of our future events, and we appreciate you so much. This survey will only take 5 minutes, maybe even a little bit less. Please let us know your level of agreement to the following statements. Question 1, this event met my expectations today. Question 1, this event met my expectations today. For yes, please press 1. For no, press 2. And if you're unsure, please press 3. Question 1, this event met my expectations today. For yes, press 1. For no, press 2. And if you're unsure, please press 3. If you feel you can use more support for managing your diabetes, check out diabetes.org, the website for ADA. There are lots of fantastic links to information that can help you with your diabetes journey. Question 2. I will attend another Ask the Expert event. Question 2. I will attend another Ask the Expert event. For yes, press 1. For no, press 2. And if you're unsure, please press 3. Question 2. I will attend another Ask the Expert event. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Anytime you want more information about obesity management, please visit diabetes.org/obesity. That's diabetes.org/obesity. Moving on to question 3. This event improved my knowledge of how to have a conversation about obesity with your healthcare provider. Question 3. This event improved my knowledge of how to have a conversation about obesity with my healthcare provider. For yes, press 1. For no, press 2. And if you're unsure, press 3. This event improved my knowledge of how to have a conversation about obesity with my healthcare provider. For yes, press 1. For no, press 2. And if you're unsure, please press 3. Did you know that there are approximately 38 million people with diabetes, so you are not alone? If you're looking for peer support, the ADA Peer Support offers peer support through local state offices, diabetes camp, online forums, and more. Please check out diabetes.org/community for more information. Only a couple of questions left. Question 4. I intend to use the knowledge I gained in my or my loved one's next appointment with a healthcare professional. Question 4. I intend to use the knowledge I gained for my or my loved one's next appointment with a healthcare professional. For yes, press 1. For no, press 2. And if you're unsure, please press 3. Please remember to check out nodiabetesbyheart.org. That's nodiabetesbyheart.org to learn more about how to take simple and practical steps to reduce your risk of heart attack, heart failure, diabetes, and kidney disease. Question 5. Before this event, I felt confident talking to a healthcare professional about my or my loved ones, how to have a conversation about obesity with my healthcare provider. Question 5. Before this event, I felt confident talking to my healthcare professional about my or my loved one's ability to have a conversation about obesity with a healthcare provider. For yes, press 1. For no, please press 2. And if you're unsure, please press 3. There's so much to know about taking care of your health when you're living with diabetes, and it can be overwhelming. So if you want to learn more about strategies and tools for diabetes burnout and mental health, please visit diabetes.org/health, wellness, mental health. Last question, and thank you for taking this survey. Question 6. After this event, I feel confident talking to a healthcare professional about my or my loved one's ability to have a conversation about obesity with a healthcare provider. After this event, I feel confident talking to a healthcare professional about my or my loved one's ability to have a conversation about obesity with my healthcare provider. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. We sincerely appreciate your time and look forward to engaging with you on a future Ask the Expert event. Please remember to visit diabetes.org/experts to learn about upcoming events. And we thank you so much for your time tonight.